how does this kind of thinking yield different solutions than we're pursuing now?
Well, I think I'm going to echo a little bit of what Steve said. I mean, so I think that the core proposition of planetary health is that we all receive enormous public health benefits from a relatively stable set of biophysical conditions, whether we're talking about the climate system or land cover or biodiversity or coastal barrier systems or fisheries or biogeochemical cycles, that those natural systems give us, as Steve was talking about ecosystem services, a lot of health benefits. And that we're now facing a sort of quiet and barely visible, but nonetheless urgent public health threat as we transform those natural systems at a rate that is much faster, in a way that is much more pervasive than we have ever seen as a species. And the primary driver of that vast transformation of Earth's natural systems is human activity. I was thinking about this, I was trying to explain to my daughters a little bit about what I was talking about in planetary health, and I was saying, it's like for almost all of humanity, we were a monkey in a rocket ship, and we were passengers in the rocket ship with all the other species on the planet. And then somewhere around 4 or 5 decades ago, the monkey scampered up to the cockpit and pushed the big red button, and the rocket ship took off, and suddenly we own the rocket ship. And we're pushing buttons and turning dials and pulling levers, and we really don't have any real understanding of the consequences of transforming just about every natural system on the planet. And it really matters, because these are the natural systems that underpin our global food production system, our exposure to most infectious diseases, our exposure to natural disasters, even the habitability of some of the places that we live. And so I would say, planetary health is this emerging interdisciplinary field that is committed to very rapidly growing our knowledge about how transforming natural systems will impact human health. And Steve talked about some of the areas of research. We work on how rising CO2 affects nutrition, how loss of pollinators affects the mix of foods that we eat and nutritional and health outcomes, how the fires in Southeast Asia affect health. But then injecting that rapidly accumulating knowledge into the realm of policy and practice so that we can manage Earth's natural systems in ways that optimize human health outcomes to try to avert some of the kinds of public health threats that we're worried about. So to go back to the monkey, we need to teach the monkey how to drive the rocket ship as fast as we can before it crashes.